Dissociation can also have connections with self-harm. More common forms of self-harm may be cutting, hair twisting, pulling out eyelashes, or skin picking. To the person who has never felt compelled to cope with it in this way, it seems enormously painful and counterintuitive. However, Dr. Perry explains that because of the dissociation, the numbness to the body creates a separation from or lessening of the pain. Anytime our bodies are harmed, our brains flood with the natural opiates to shield us from the pain and oxytocin to comfort us. Dissociation disconnects us from the intensity of the pain, so all then that is felt is the relief. Some clients I have worked with talked about blood being satisfying. But according to Dr. Perry, it is more likely realistic that the satisfaction comes from the brain's chemical release. The blood just may visually be associated with the release. So it serves as a trigger that the relief is coming. It is terrifying to learn that a child is self-harming. It may be tempting to shame or punish the behavior. I hope this understanding gives you courage to reflect compassion to your child for the depth of the suffering they must be experiencing, and motivates you to seek help with a trauma-trained therapist. Through yoga, meditation, and mindfulness, we can reconnect to our bodily or somatic sensations. This reconnection is necessary for healing to take place. That is why it is imperative to find a counselor for your child who is trained specifically in the treatment of trauma, and why it is vital for your recovery for you also to practice self-care, healing practices, and seek therapy for yourself. Let's take a break so you can reflect on what you have heard, what you have felt, and the questions for this section. These questions help guide an action plan toward healing for you and your child. I hope that they give you a sense of hopefulness. Question number 1, what are you feeling, thinking, fearing, and what do you need for support? And question number 2, what can you do today to help your child feel safe, loved, and supported?